Hey there, Dr. Todd Cameron here, GP and co-founder at M3 Health. Today I want to chat to you about how to get the best out of your general practice consult, just to make sure that you get superb value for money when you do need care. Now, you all have heard us talking about this for a while now, but over the last few decades, there's been a progressive lack of funding, funding for your rebates, the patient rebates, Medicare and MBS rebates into general practice. And what they've done in preference is to fund the hospital system. The problem with that is the hospital system is very expensive, and because they've underfunded general practice, more people have ended up requiring hospital care. What that means, though, is that general practice is going to be much more expensive for you to access, and that's really unavoidable because of the neglect. And there's been more than a decade of freezing of fees, and of course, there's inflation in all the things that you know about, rents, staff overheads, etc., etc. The things you'd expect. And so what that means is you will be paying more for general practice care both now and in the future, unless your federal government does something about this. In order to find out exactly what the fees are, please go to our website, have a look at the fees tab, and it will give you a bit more detail. The only group of people that at this point in time we are able to bulk bill is children aged 5 and under, so preschool children and those with pension cards. Beyond that, everybody will be fee paying, and there are a couple of exceptions that I'll walk you through in a moment. But it's important to remember there are two main types of consultations that you can access. Doesn't matter whether it's through face-to-face or whether it's telehealth, phone or video. You can have a standard consultation. That's a 15-minute appointment, but it does not mean that you end up in front of the GP for 15 minutes. Generally, it's about 10 to 12 minutes face-to-face with the GP. The reason being that the first minute or two, the GP will be working on your file to understand your background, to know if there's been any pathology results, letters, etc. in between your prior visit and this one. And then at the end of the consult, a bit of time is spent making sure that you don't need any prescriptions, repeat scripts, that you don't need any referrals, medical certificate, all of those kind of things, just to make sure the consult is neatly closed up and organise future appointments. You can typically only cover one problem in a standard consult, and it's not usually a long or complex problem. So make sure that you plan appropriately. If you have got a multitude of things you'd like to do, please write them down and make sure that really early on in the consult you get that list out, go through it with your GP so you can work out the priority together and organise another consultation to catch up on the other matters. Long consultations are only video and face-to-face. You can't do a telephone long consultation. Those are 10 minutes or less. And so when you make a long consultation, you may get through one complex or long-standing issue. Occasionally, you might get through 2 or 3 that are fairly straightforward. But again, you're going to need to make sure that you plan well and write down on a piece of paper or on your phone, if you need any scripts, referrals, if you need any documentation filled in, certificates, etc., so that you get everything done that you need to do, not just the things that you're planning for that consult, but also anything that you're planning as relevant in the next few months would be useful to talk to your GP about and get the most value that you can out of the time that you spend together. Now, chronic and complex care will usually come under a care plan. There are 2 documents that we talk about, 2 types of funding that are available to patients called team care arrangements and GP management plan. At this point in time, we bulk bill team care arrangements, GP management plans, and also health assessments. So it means you continue to get those visits funded directly by the government. And that may be up to 3 visits per year. So if you use those wisely with the others, it often reduces any financial burden that you might have on yourself. But it is super important to plan well and to plan in advance so that you get the most out of your time with the GP. Please don't run over, because it does affect the way that other patients access care. We understand there are emergencies, of course, that sometimes throw out the best planning, or there is sometimes chaos in people's personal lives, and that is usually the reason why GPs run late. So we'll do our best, you do your best, and overall that will make the system better for everybody. We do have our appointments through HotDoc. You do need to financially consent to the consultation by entering your payment details at the time of making the appointment. Otherwise, you can't make an appointment. There is a late fee if you don't pay on time. That's $27.50. 97% of patients that attend our clinics pay for their consultation at the time of the consultation. Please be one of those. Avoid that late fee because it is not MBS rebatable. Thanks for working with us. We look forward to providing you general practice healthcare for a long time into the future, and that's why we've had a focus on sustainability. Thanks, and look forward to working with you.